Everybody's getting settled in. Fantastic. So we'll get right to it in interest of time. I'm going to do a quick introduction. Gabor said you don't need to introduce me because I was here yesterday, and so I'm just going to start with Trevor. Trevor Millar is a social entrepreneur and co-founder of Liberty Root Ibogaine Therapy, serving those called to experience the healing properties of Iboga and its derivatives. A powerful addiction interrupter, particularly effective for those dependent on heroin and opiates. His interest extends to the potential of psychedelics as revolutionary tools and how to best empower individuals beyond states of dis-ease. Instead, align with the perfect wholeness through which want of healing ends. All right, I butchered that, but please a warm welcome for both of our presenters, Trevor and Gabor.
Hello, how is everyone? Great conference so far? It is. Cool, so Gabor will be up in a bit so we can answer any questions together. He's been a very big support of our work from the get-go, so it's an honor to be able to share the stage with him. And today, we shall cover some Iboga basics. Iboga is almost a dark horse in the psychedelic world. Not a lot of people know about it because it is really not recreational at all, where other things, it can be somewhat enjoyable. Iboga seems to not hit those notes for a lot of people. Ibogaine and addiction, the Western use of Iboga, which is how I became familiar with this plant. The formation of Liberty Root, which is our company. My business partner, Gareth, is in the room as well. I'll give him a shout out right now. He just waved in the back there. Thanks, Gareth. And I'm very interested personally in what psychedelics can be as transformational tools. And of course, that's why we're all here. Psychotherapy leads to some form of transformation, we hope. But I like the idea of what we can do personally to move ourselves forward with that. This is the Iboga plant. It has that fruit. It is actually the root bark of the plant that is used. It is of traditional medicine in Africa. Gabon is the primary location of where this is used traditionally. It is said that the Pygmies brought the Iboga medicine to the people of Gabon, and the Bwiti religion was formed out of that. These are some images from ceremonial Bwiti use of the medicine. Historically, it's said the myth associated to Iboga is that a raccoon was eating this plant. A hunter killed the raccoon and went on this journey, and that's apparently how it was figured out that Iboga has these medicinal qualities. The Western use of Ibogaine for addiction therapy, it looks like I dropped a C there, addition therapy, maybe subtraction therapy. Western use of Ibogaine for addiction therapy started with this gentleman here. His name is Howard Lotsoff. In 1962, he was a pretty big heroin addict. That's probably a picture of those times. And we heard from his wife, Norma, that what happened was his chemist buddy knew that he would try anything and said, here, try this Ibogaine stuff. He said, sure. And he was walking in New York City to his psychologist's office, spent the next 2 days on that psychologist's couch, and came out the other end and he said, but wait a second, I haven't wanted heroin the whole time I've been on this, nor do I want it now. So he really became the original champion for the use of Iboga, the way we use it at Liberty Root. He started an association called the Global Ibogaine Therapists Alliance. It's actually now called the Global Ibogaine Therapy Alliance, to be a bit more inclusive. He came up with the manual for Ibogaine therapy along with some other co-authors, and that has actually just hit a new stage. There is a new clinical guidelines for Ibogaine-assisted detoxification that GIDA, the Global Ibogaine Therapy Alliance, has put out. That's just within the last few weeks. And it's a seminal guide. It really touches on so many aspects of Ibogaine that were not in that first edition of the manual. I think it's available online. You can check it out. You might notice that the guy on the cover. That a photo shoot was done to get some stock photos of Ibogaine. It was done at our facility, and I ended up being the model on that. This is available online as well, the Ibogaine Patient's Bill of Rights. You can't read it very well there, but I think this is I wanted to definitely make sure I included this in this presentation particularly because I think this is a great document if you do search for it online that can be used for other medicines as well, just to let people know what their rights are as people that are receiving psychedelic therapy from you. The patient has the right to understand the rights. If for any reason you feel like these rights are not being met, let us know. The patient has the right to receive treatment with Ibogaine and to be informed of the dose is the second one. I like this third one a lot. The patient has the right to receive complete information about your diagnosis, treatment, and prognosis. And I think that's lacking in traditional Western medicine from what I've seen. We have to have, our clients all have to have EKGs and blood work done beforehand, and you wouldn't believe the resistance to, number one, getting those tests done, especially in Canada. We should be able to walk in and say, I have a health concern, or I'm looking for this kind of alternative therapy. It'd be great if I could have an EKG and some blood work, please. They have to fight hard enough for that. But then to get the results, it's they say they won't give the results to the patient itself, and they say that's due to medical confidentiality. Yeah, but you're the patient. So it's I hope that this realm of psychedelic psychotherapy kind of steps back from where Western medicine has gone with that. You can find that online. This is Iboga. This is the plant itself. Tabernanthe iboga is its formal name. Like I said, it's the root bark, the second layer of root bark. So they scrape off that first layer, and then it's the second layer of root bark, which is Iboga itself. And that's what would be used ceremonially in Africa. You would have to consume, copious amounts of very alkaline sawdust, basically, maybe 30 to 70 teaspoons of that over the course of your Iboga journey in the jungle. It can be refined, thankfully, and the first refining process, you're left with that brown powder there, which is called Iboga TA, total alkaloid, and that's using a mild vinegar or lemon solution to pull out all of the alkaloids that are in that bark. And then you can refine it one step further, and you're left with a white powder using a hydrochloric acid solution. So it's called ibogaine HCl, and that's just the ibogaine molecule. And that's what we mostly use for addiction treatment. There's a lot of contention. What's the difference between TA and the HCl? It's impossible to put into words. I've had a client come in and said, it's often said that the TA is maybe there's some more spiritual components to it because there's more alkaloids there. And I've had a guy come in and say, well, for the money I'm paying you, I'm more spiritual. I want that TA. I'm like, all right, man. So I gave him the TA, and the more spiritual tends to be where the work is done, perhaps. So he had a really tough time that first day with the low dose. Like, is it all right if we switch to HCl now? Yes, please. Yes, please. So, and then this plant down here, that's Volcanga africana, and that is a plant that's related to Iboga. Iboga there's sustainability issues. There's a lot of people after it, mostly people in the Bwiti religion. A lot is consumed through that religion. So there's some sustainability issues. It may be over-harvested. So the Volcanga africana, it contains something called volcangamine, which can then be converted to ibogaine. And that's the Remagen ibogaine, which I'll speak about in a second. It is that Volcanga africana turned into ibogaine, which is still 99.9% pure. The legality of ibogaine in the USA is it is a Schedule 1. Schedule 1, of course, the drug has a high potential for abuse. Ibogaine does not at all. The drug or substance has no currently accepted medical use in treatment in the United States. Maybe not in the United States, but over in White Rock, we see about a 65% success rate beating chronic heroin addiction. So that's a questionable number 2. And then the safety use, there is some safety issues with Ibogaine. Out of all of the psychedelics that are going to be spoke about here, this is the one that kills people. And you do need to do very proper screening. There's a lot of protocols that we have learned over the years in doing this that are very important. And I used to, the way this started for me was, it started with people knowing I was interested in Ibogaine, and the phone would ring. And initially, I, for a little, very short time, coached people on how they might do it best themselves. And now that is not something I would ever say. After all the ups and downs we've seen within our controlled environment, it's something you should not be doing alone at all. So there definitely is some safety issues, but under the proper supervision, you can mitigate most of those issues. In the United States, it has been used for some trials, basically. So that's just an image of the permit to import that illegal substance legally into the United States. In Canada, Ibogaine is recognized as a natural health product by Health Canada. This is the Government of Canada website that talks about Ibogaine, a picture of its molecule. While it is a natural health product and is recognized as such, it is not approved for any specific use within Canada. So in order to be able to distribute Ibogaine within Canada, you need to have, or have it imported even, you need to have that specific label for use. So it's still hovering in a gray area there, and I'll talk about how we're hoping to change that.
Yeah, Trevor.
Yeah.
Didn't a bunch of product get seized recently?
Yeah, so that's exactly where I was going right now. So Remagen was operating out of Montreal, and they had permission from Health Canada to import the Ibogaine as long as it was not going to be sold to anyone in Canada. And apparently that agreement was made, and then that agreement was broken. So Remagen did get all of their products seized and destroyed, and they're looking at a way to kind of make everything a bit more formal, get a site license, which is required to do that distribution. Remagen is a really great product, though, so it was very sad that that happened. They have really set the benchmark in doing the GMP, which is properly manufacturing. Any pharmaceutical needs to be done in a good manufacturing practice. They did do that. This is Remagen's, you'll see 99.9% pure Ibogaine. And the formation of Liberty Root, which is the company that put me in front of you here today, it started out of a social entrepreneurial mission to help the downtown east side. In 2001, I started reading too many books, and at a certain point I'm like, why am I reading these books? Well, these books, you're reading them because you want to be happy. Okay, well, what do all these books say about being happy? Well, it seems to be that the happiest people help the most people. I didn't like hearing that at all. I was just a hotel manager and was planning on staying that for the rest of my life. But I said, you know, let's take this theory and see if it's correct. Will I be happier if I help more people? Well, what needs help? And it looked like the downtown east side of Vancouver needed a lot of help. So I just started going down there every day, doing a lot of research. That for 15 years, it would have looked like I hadn't have gotten anywhere on the surface. But I made a lot of contacts. I did a lot of thinking about it. And eventually, Ibogaine came across my path as something that might be able to help people. So I started deeply researching that. And I was invited to the Global Ibogaine Therapist Alliance conference in Vancouver a good few years ago now. And there I was introduced to my business partner, Gareth, by the gentleman who ran that conference. And Jonathan said Gareth's interested in working with Ibogaine in Vancouver. And we decided to see what we could do about that. So that's a good many years behind us and more than 100 clients behind us now as well. So very good. This is Liberty Root. This is the place that we do the work out of. We started in a small townhouse, and we use the master bedroom as the treatment room. And we've grown to a place where we can now take 3 clients at a time. It's very exciting. There's been a big learning curve going into this bigger facility, but I think we're through that learning curve and doing some great work there. Our mission from our website is to safely and knowingly guide our clients through the entire Ibogaine experience, consciously playing our role in helping to potentiate lasting transformation. Like Virgil to Dante, we stand beside our clients through their journey, lovingly reminding them of the ultimate destination. That Virgil to Dante, the Divine Comedy reference, comes from Claudio Naranjo in his book, The Healing Journey. He talks about psychedelic therapists as being a lot like Virgil to Dante. If you know that epic poem, Dante finds himself in hell, basically, and Virgil is there to say, we're going to go through hell, but don't worry, there is a destination at the end. We're aiming for something greater. So as he hit those dark spots, he's able to say, see that? You don't really want to come back here, do you? Let's keep moving on. So that's how we kind of view our role. Our philosophy is that Ibogaine is not for everyone, but for those who jump through the barriers needed to come to the medicine. We know it can be a radically healing experience. We're honored to play a role in something so profound and strive to act in accordance with this privilege with every client. The application process. The clients find us generally through our website, and we're on some lists of Ibogaine providers on the internet as well. We don't do any advertising. I've said many times to people on the phone that say, well, why should I come to you? And I said, I have a really strict policy to not sell Ibogaine to anyone. If you have done enough research and want to know more specifics, I'd be happy to help you with that. But otherwise, you need to dig in, and we're not advertising in the newspaper. We're not trying to wave ourselves out there. I've turned down multiple media requests for interviews because it's something that we would like to attract people that are meant to come to us. We do a phone screening, then we do an application that asks them their medical history, their history of addiction, their psychological understanding, what great joys and disappointments do you have, what was your spiritual background growing up, what are your aftercare plans are very important. We try not to take anybody that doesn't have a really good, solid aftercare strategy for after they leave 10 days with us. Medical tests, we do a 12-point EKG to test the heart, and then do a couple of blood tests as well. That's just a screenshot of the application. There's a few more pages to that, but gives you an idea. Contraindications, reasons you couldn't take Ibogaine. There's quite a few up there. Basically anything acute that's going on. It is a very taxing time. It's a 36-hour-long psychedelic trip. And we're throwing a very powerful alkaloid into a person's body. That's going to mess with somebody's chemistry, everybody's chemistry that takes it. If your chemistry is already compromised, then the chances are something negative might happen. Pre-treatment protocols: drink lots of water, at least a couple of liters a day, take high-potency vitamins. We have a very strict supplement regime that we ask people to do beforehand that we've included in the last 6 months or so. Eat healthily, try and avoid some sugar, drink lots of electrolytes. We do ask people to stop taking antidepressants generally for about 2 weeks before they come. Antipsychotics. If somebody is taking a antipsychotic, that might be a contraindication. They wouldn't be able to come in the first place. Discontinuation of medication must happen with the physician, of course. Straightforward stuff. So this is what happens when a client comes to us. Upon arrival, we do have a doctor that works with us in Vancouver to prescribe morphine to any opiate addicts that come in to see us. So if for those of you that don't understand opiate addiction, if you don't have that opiate for 6 to 12 hours, you go into severe physical withdrawal, and it hurts very, very badly. So we don't need people to be in that withdrawal. They can be comfortable for the first couple of days with us. So we're so grateful and so blessed to have a doctor that prescribes morphine so they can stay on as much oral morphine as they need for the first couple of days that they're with us. For those first couple of days, we do the morphine, lots of supplementation, lots of hydration. And then when we do start working with the medicine, our protocol is to do some low dosing with the medicine before the large dose. So the low dose is just a small percentage of what the large dose will be. It takes away the withdrawals for the most of the day. We call it a handshake with the medicine. They get to see what Iboga feels like a little bit. It takes away a little bit of the fear in most cases. And because it was just a small amount, the withdrawals tend to come back that evening. So we're able to put them back on morphine very carefully. And generally, we cut their morphine in half just by those low doses. So the first day, I've got some charts here in a second, but they'll come in on quite a bit of morphine. After a bit of Ibogaine, it lowers that down. So they need a lot less to be comfortable. Here's some charts actually. So the green line is the morphine milligrams that they came on, and the yellow line is milligrams of Ibogaine. So R here came in the day one, he came in the evening, so he didn't need that much. But day two, he was up to about 220 milligrams of morphine. Then we administered some Ibogaine, and you see that in order to sleep that night, he needed less. A little more Ibogaine the next day, less morphine, little more Ibogaine, less morphine. So you'll see that's pretty common in all of these charts here. So it's neat to see, a lot of people in the medical profession would say that's impossible, but they hadn't heard of Ibogaine. But we're doing it kind of week after week. And then the big dose is called the flood dose. So we do have a registered nurse that comes in and is present for at least the first 12 to 24 hours of the treatment. A larger dose of Ibogaine is administered. The client spends generally anywhere from 18 to 36 hours in bed. They're severely ataxic, so very shaky. They need help to go to the washroom, for example. And there is a human being with them in the room for that entire first 24-hour period at least. And we test blood pressure constantly. The nurse will monitor. We check blood pressure every 15 minutes or so for the first 5 hours or so. We're monitoring everything that's going on. After 18 hours or so, the client may be ready for a change of scenery, so we'll move them to another room. Food may be requested. And then at about 36 hours, almost like clockwork, the Ibogaine lets up enough to allow a person to get to sleep. And then they'll get a decent night rest, and then we proceed with smaller booster doses of the medicine as well. And we have people for 10 days now. It says 8 or 9 there, but everybody stays about 10 days. Aftercare, we consider Ibogaine a detox. It's a detox with benefits, but if somebody looks at it as a detox and then prepares their life around what are they going to do afterward, it's from the website. It said that using Ibogaine is like stepping through a doorway into a more innocent state, but once through, there's a vacuum that's going to try and suck you back into your old ways. So rather than stepping through a door, we suggest that you run. So have a plan for healthy new habits that you're going to implement. Maybe go to a vacation or a longer-term recovery house after your visit with us, or do what you can to passionately dive into conscious self-improvement, which is a passion of mine. Our experience to date, we've treated approximately 100 people, not all of them for addiction, but for those ones with addiction, I did a loose survey going through all of our files before I got here. And I did another one of these surveys a few months ago, so I had a pretty good idea of where people are. We're showing about a 65% success rate treating addiction, meaning they may have relapsed after they left, but they're not using by the time I did that survey. And meaning the people included in that, there might have been a guy that left last week within the numbers compared to a person that left a year and a half ago. In attempting to make an estimation of the factors that lead to relapse, we don't want to treat people that we don't think this is going to work for. And if there's any one word that seems to resonate as true as to why it doesn't work for some people, it's just a certain level of immaturity. So whether they're actually young, maybe 25 years and under, we're very hesitant to treat people 25 years and under. They're fairly new to using. That's another immaturity, is if somebody is fairly new to using, there's still a bit of a love affair involved, it's going to be really hard to let go. And then we've seen people with certain emotional immaturity that, after a few days there, you just start wondering if they kind of have their stuff together enough to make this work. And another factor to consider is that success doesn't necessarily mean staying off of the drug that they came in to get off of. There are vast and hopefully great lessons that are learned through Iboga itself that they can add to different aspects of their life. But one of the greatest lessons is, if you go to a good provider, and I think we are pretty good at this, within 10 days, that person is physically no longer addicted to opiates. The addiction is gone, and for somebody that's been addicted to opiates for a long time, to get through that experience and not have those withdrawals, that's a huge, light at the end of the tunnel. So even if they do go back, people know that Iboga will work for them when they are completely ready. And we have had a few return clients for sure who, they went home, they slipped up. I was speaking to a gentleman last week who's going to be coming in again next week. He said, I keep reliving that time that I used dope, that I left you guys, everything was good, and just that one time, if I could just take that back. So the way to take that back is to come in and do a bit more Ibogaine with the insight that you gain, the wisdom that you gained from what happens if you do use only that once. This grew out of the downtown east side. Our passion has been to give back to the downtown east side of Vancouver. For anybody that's out of town, the downtown east side is considered the poorest postal code in Canada. So it's got some pretty serious issues and a lot of issues around drug dependence. We worked with VANDU, which is the Vancouver Area Network of Drug Users, on our pilot project on what we might do to give back to the downtown east side. We wanted to treat people for free from the downtown east side and see what might happen. In order to do that, we didn't want to, as Gabor mentioned yesterday, if you just take somebody, give them Ibogaine, and sure, we'll clean them up, but if you just throw them back into the downtown east side, they might be able to resist for a week or two, but you stay in the barbershop long enough, you're eventually going to get a haircut. So that's what we, aim to kind of mitigate, make sure that didn't...
That happened to you?
Yeah, sir. Thanks, buddy. So we worked with a group. It started with me speaking to about 300 people, which then turned out to about 15 people at the first meeting, which then turned out to about 5 people meeting us every week for about 90 days. So we really did what we can to get people ready and see who was going to be ready. At the end of that, we were left with one gentleman, Aaron, who came in. He was treated. He has relapsed. We're speaking with him about coming back in and doing something else, but his life is a lot better. Like, you can just tell very easily on the surface. He's a happier guy. He's involved in the community. He just put on a seminar last week on the downtown east side about the legalities of, the legality of prohibition itself. So his life has been greatly bettered through his interaction with us at Liberty Room. The pilot project takeaways are the correct attitude of the patient is paramount, even more so because of the downtown east side and its circumstances. We're looking for a willingness to learn. We're looking for a willingness to accept change in people who are open to personal development. Empowering habit force, it says there. Habits can destroy a life, bad habits can destroy a life, but the exact same force is at work in creating a beautiful life. So if you take away this thing, opiates for example, they might spend 95% of their time focused on opiates during the time that they're using it. You take that away, all of a sudden there's a vacuum there. You need to fill that vacuum with something. And empowering habits, and we work with something called the Rule of 5, which is 5 things that you do every day, that if you know you're doing those 5 things, your life is moving forward. So we really do what we can to try and get people to create some empowering habits rather than those destructive ones. Moving forward, we're working towards a clinical study in conjunction with St. Paul's Hospital. Mark Hayden, who is a speaker here, put together a meeting which was essentially me giving this. That's what this PowerPoint presentation was originally created for, was for that meeting at St. Paul's Hospital in a boardroom in St. Paul's. The floor was pretty much instantly handed over to me. I did this quick talk to which the doctor in charge said, "Are there any questions?" Nobody really had any questions, and the meeting ended with them saying, "We're very excited to work with you." So one of our clients has spoken to St. Paul's and has created, they're hopefully publishing a paper very soon just on her personal story and observational study. And then the goal is, and there's still a lot of loopholes to jump through to make this happen, a lot of hoops to jump through to make this happen. But the plan is for St. Paul's to get 25 clients and send those to us, and 25 clients will go elsewhere as well, and we'll be able to get a true clinical study done, which is something that Ibogaine desperately needs. And we are looking to expand that downtown East Side scholarship program, and I think this is a great room for that kind of thing. If that kind of resonates with anybody, be in touch with me through our website, send me an email, my phone number will come up here in a second as well. If you're passionate about the downtown East Side and doing something down there, I'd love to get a community together that are interested in doing something innovative down there. Psychedelics as transformational tools. What time do we wrap up here?
I think we're a bit over.
So I'm gonna, this be your own superhero. I do a lot of blogging. As I learn things, I like to record them, and as I record them, I put them on the internet, because I think there's a lot of insights that are gained from a personal journey, taking psychedelics, learning a lot from psychedelics, and those lessons can be shared. Be your own superhero, that's really about creating the largest vision for yourself. So, like I said, you can use those habits to destroy a life. You can also use habits to create a life. That Be Your Own Superhero, which is available at libertyroot.net, be-your-own-superhero. And it just talks about a really grand, inspirational vision. Like, people say, people will ask, what more can I do to stay off drugs? We'll create a really awesome life where you don't feel the need to take drugs to dull yourself. So that paper is a bit about that. So I hope you get a chance to check that out. And thank you very much. I think we'll have a bit of a panel now with any questions.
Trevor, would you mind just moving your... I will not say a lot. We'll just take questions, actually. But two things I want to do. One is how does this actually work? So I'll read you 3 sentences from a scholarly paper on the mechanism of action of Iboga. Initially, Iboga's mechanism of action was hypothesized to involve antagonism of the N-methyl D-aspartate type glutamate MDMA receptor. However, 18-MC, which is negligible MD, etc., nobody knows how the hell this stuff works. All this gobbledygook about the potential brain stuff and which chemicals are involved, which brain circuits. What I can tell you is that it does seem to rewire your endorphin receptors. So I did Ibogaine a number of years. It's okay. It's good. Thank you. I did Ibogaine a number of years ago. I was not for any addiction or anything. Just because why not? And as Trevor said, I was functionally Parkinsonian for about 8 hours. And I didn't have a deep spiritual experience either, but then I never do. But for 3 months afterwards, there was a kind of negativity that was lacking in my life. The kind of an automatic default dark view of the world. And they said the effects last 3 months, almost to the clock. 3 months later, all of a sudden overnight, that positive shield that I had disappeared. So it clearly did something to my brain receptors. It did rewire something, not permanently, but it did. And I really enjoyed those 3 months. And now, of course, the thing is, how do you get there without relying on substances. But the point is, it does do something in the brain that probably has to do with the endorphin receptors, which is why it is so powerful in preventing withdrawal. And it's quite amazing that you have a client who's been on heroin. Well, I can tell you one case. I had an email some years ago from a husband of a woman who'd been a heroin addict for something like 15 years and then was put on methadone, and she's been on methadone on 10 years. Now, methadone is an opiate that is a legal opiate when it's prescribed. It's a long-acting one, and it simply is the replacement of one opiate addiction with another. So it's not that when you're on methadone, it's not that you're addicted, it's just that you're addicted to something legal that you don't have to inject, you can just take it by mouth. So that provides some benefit for some people, but people hate it, and they're on it because if they got off it, the withdrawal is horrible. So they are on it for decades sometimes. It might help them function better. But this woman called it liquid handcuffs, you know. So they live in Toronto, and I said, okay, I just happen to come to Toronto for next week for a speaking engagement. Why don't you meet me at my hotel? We'll talk about it. In todders this, her name is Lisa, in todders this wildly made up, lipstick smudged, stiletto heeled, dressed up like a tart, woman in her late 30s, squeaking like a little girl. And so I talked to him about half an hour, and I said, look, if you want to get off the methadone, do the Ibogaine. And then come and do ayahuasca with us. So that's what she did. So she went to Mexico to a clinic. This is before Trevor's operation was going. And she got off, literally within 2 weeks she was off her opiates. So this is after 25 years of opiate use. She was no longer craving and not suffering any withdrawal, which is absolutely mind-blowing. And again, it's one more thing that as a physician I hadn't heard about until about 5 years ago, maybe even less. And it's astonishing that here's this modality that even if we take your statistics of 65%, Trevor, and even if we reduce them to half, it's still amazing. It's still amazing. So, now my point about Ibogaine though is that there's a reason why people get addicted. So we see the addiction as the primary problem, but it isn't. Let me just ask you, addiction is any behavior that people pursue, they crave, they find some temporary pleasure or relief in, but continue with it despite negative consequences. So that's any behavior. It's not to do with substances. Anything that you crave, find pleasure in, and you pursue despite negative consequences, by which definition, how many of us here have addictive behaviors in our lives? Just put your hand up if you have. Okay, that's most of us. So if I asked you not what was wrong with it, but what was right about it, I'm not asking you what you were addicted to, when or for how long, but simply what did you get from it in the short term? What would somebody say? Just put your hand up and tell me what you got. Yeah?
Escape.
From
Just the unpleasantness of...
So some pain.
Yeah.
Okay, escape. So pain relief, yeah? Okay, what else? Anybody else? Yeah?
Discovering I existed.
Okay, some sense of yourself, is that right? Okay, great, thank you. Yes?
I would say comfort in sort of the predictability of the routine.
Comfort in a predictable...
Of the routine that goes with consuming that particular thing.
Okay. Yeah?
Reduction of stress.
Reduction of stress. Now take all that stuff. Yeah, one more.
Like connection and ritual.
Connect them with what?
Like connection
To something greater, something greater than you.
Yeah.
Okay, great. So look, if you look at all that you said, reduction of stress, pain relief, connection to something greater, whatever else you said, anything wrong with any of that? Isn't that what we all want? In other words, the addiction is not the problem. The addiction was your attempt to solve the problem. And the real issue is, why did you lack connection? Why did you have so much pain? How come you had that much stress? And how come you had no internal capacity to handle the stress? So that you had to soothe it. So this idea that addiction being a primary brain disease, which is the official medical view, is utter nonsense. The addiction is the attempt to solve a problem, which also means that just because you've solved the addiction problem, you still haven't solved the problem. So therefore, Ibogaine can't be the, and Trevor talked about this door. The Ibogaine can't be the, it's not the end of the road, it's the beginning of it. And so, that's why I suggested to Lisa, well, come and do the ayahuasca afterwards. Really get to know yourself, go deeply with your issues, and particularly the traumas, and the way you've compensated for your traumas, which is really what's kept you addicted. So that's really important. Now, Lisa, you should see her now. No longer wearing stiletto heels, no longer stupidly made up, speaks with the really resonant voice of an adult woman. You should just see her. She just embodies presence. And on the other hand, there's Cynthia, who's a woman from the downtown east side, who Trevor knows. Cynthia began her journey with us with ayahuasca. She had a lot of insight, a lot of learning. We raised funds to send her to Mexico, did the Ibogaine there, got her for opiate, didn't stay long enough in Mexico to integrate anything. She was eager to get back to her boyfriend, I think, in Vancouver. The first 3 months, it didn't last 2 weeks, it lasted 3 months for her. She would walk down the street, people that knew her in the downtown inside would rush up to her from across the street to ask her, what happened to you? Because she was just radiating presence, radiating light. She's such a wonderful light in her that's completely obscured when she's using. And there she was clear of it. And it was magnificent to see. And then, because she stayed in this relationship with somebody who was using and dysfunctional, because her attachment needs were still dominating her life, she ended up using again and has suffered terrific consequences. So it's not to say that are there any panaceas out there, but it is the case that Ibogaine does open a door. It creates a possibility, it's a possibility that simply there's nothing anywhere remotely like it in the standard medical repertoire. We're terrible dealing with addictions. We're terrible at dealing with opiate addictions. The best we can do for severe users is to put them on an equally addictive opiate and maintain them on it. And here's an opportunity for people to actually let go of the physical dependence and then to begin a growth process. And so, for all the psychedelic work, in terms of the specific addiction work, and most specifically for opiate addiction work, there's just nothing more exciting than the Ibogaine possibility. I'm just hoping that the kind of rigid and utterly irrational hostility that dominates drug policy, and particularly in the US, but very much in Canada as well, will not somehow inhibit the work with Ibogaine. And I wonder, really, is it that they get it, or is it that they don't? It's not enough on their radar yet to have clamped down on it yet. Maybe you have more of a sense than that. But in any case, so long as it's possible to do this work, it really is an exciting area of addiction treatment. I think we'll take questions. Is that right?
Okay, since we're recording this, I'm going to pass the mic to people, and then I'm going to run it back to the presenters so that they could answer.
So as I mentioned, the cool thing about opiate addiction and Ibogaine is we just wait till somebody's in a slight bit of withdrawal, and then we can administer the medicine. It is effective. I always tell people it's kind of effective at interrupting any negative pattern that you've got going on that you would like to step away from. The thing with alcoholism is we can't treat somebody who's in a detox mode. So with alcoholism and stimulant use as well, we need people to be off for at least a couple of weeks. And it's a slightly different treatment protocol, but we've seen good success as well with some alcoholic and ketamine even addiction. So adverse events, I think the biggest thing with that is preparation to avoid them from happening. With the low dosing, we do that, the 3 days of low dosing. When my business partner and I made the decision to do that, that's not a very common thing within the Ibogaine world. Normally it's you come in, you have a small test dose just to basically make sure you're not allergic to it, and then they hit you hard with that flood dose the next day. We find with the low dosing over the course of 3 days, it really works like a truth serum. You get to see where people are at. You get to find out if people actually are ready to stop taking opiates. We tried to treat somebody else for free from the downtown east side as well. But after day 3 of low dosing, she said, I'm not ready to let go of this. And then we have the same thing with kind of health things. If we see over the course of those few days that things aren't going well, maybe they're not consuming enough liquid, they're not eating enough meals, we'll send somebody home, we'll refund their money. It's $6,500 plus GST to come stay with us. And that's 10 days at, that's a 6,500 square foot house on a couple of acres. So there is a lot of expense. We're definitely not getting rich doing it.
Thank you very much.
I think Trevor will want to certainly answer this one as well. And this is a conversation I've had with Ibogaine providers in Mexico, for example. I'm not, I mean, you can't generalize, but my experience of the Ibogaine it was an intense physical experience. For me, it didn't come anywhere close to the insight and depth that I get with the ayahuasca. And I just find that, first of all, Ibogaine is intensely physically uncomfortable. I mean, you can get uncomfortable with the ayahuasca, but it's nothing like the Ibogaine. You know, you get really ataxic. You just can't even move without assistance. Secondly, Ibogaine, not Iboga, which is the root plant, but Ibogaine does not lend itself to ceremonial use, in the sense that you really are on your own and you're with a couple of handlers who have to look after you. With ayahuasca, we get to be with 25 people in ceremony together. And it's a very, you know, just a different experience. People are chanting to you or chanting to the group very specifically in response to the energy that's being evoked at that particular moment. So it's more interactive that way. Rightly or wrongly, but my sense is that the Ibogaine can do what ayahuasca can't do, which is to interrupt the addiction and to prevent withdrawal. But in terms of which plant then can take you deeper into yourself and in a way that you can integrate it to your life afterwards, for me that's the ayahuasca. So I don't know what Trevor might say about that.
Yeah, I would agree. We're big proponents of people staying on a plant medicine journey after Iboga. It's often said that you visit Mr. Iboga once, the stern father, and then you can go to the loving mother of ayahuasca multiple times after that. I heard, you know, it's all with all these medicines, it's so hard to describe what happens to a person, but I heard Dimitri, who's kind of the rock star in the Iboga world, once say, somebody asked him what's the difference between Ibogaine and ayahuasca, and he said he'd done multiple Iboga journeys, and I think he said 16 ayahuascas at the time, and he said, from what I can see, Iboga comes from the earth. It is a root. It takes you deep into the ancestry. It's very earthy, very rooty, whereas ayahuasca's from space.
Well, can you hear me okay?
Yeah.
Okay, if you can put somebody through a rapid detox successfully, that's great, there's no argument. But the reality is, that's very few people. And especially people who've been on methadone, there's no way to do a rapid detox with methadone. Methadone actually persists in your tissues for weeks, and it's much more difficult to withdraw from methadone than it is from morphine, for example, or from heroin. That's why Trevor was people on the short-acting opiate first. You can't take somebody and work them, you know. So there are some people you can put to a rapid detox, and they do okay with it, but that's not usually the chronic opioid addicts. And most of them will not do well in a rapid detox, and we see that over and over again because they cycle through the detox in the downtown east side. People come back to detox and coming back to detox. All it gives them a bit of a cleanup for a while, but inevitably it doesn't work for them. So again, it's just not broadly applicable what you're saying. Other than that, I think no matter how you detox, whether it's ibogaine or rapid detox, whatever, again, like I said before, that's where it begins. That's where it begins, because all the stuff that made you addicted in the first place, all the shame, all the pain, all the guilt, all the spiritual disconnection, the huge vacuum that you're carrying inside yourself, all that doesn't go away just because you've got off the drug. That's when you have to begin to deal with all that stuff.
Yeah, there's not enough research on the hard science regarding this, for sure, but we're dealing with a visionary plant medicine. So people often come back with descriptions of what they saw happening on a cellular level. And with a rapid detox, my understanding is it's almost like taking that opiate, ripping it out of the system, and the opiate receptor is still going to be sitting there going, where's my opiate? Whereas with ibogaine, we've heard through the description of people's visions, is they can see what's happening on a cellular level. The reason we wait for them to go into a bit of withdrawal is that means the opiate receptor is open and free, willing to take something. The ibogaine seems to go in and scrub it and bring it to an opiate naive state as if it had never had an opiate before. Whereas the rapid detox, it sure remembers that it's had an opiate before. Perhaps. We need more research. I guess there's just a long way to go with kind of legitimizing these medicines and bringing them more to the forefront so that they could be used potentially in a more clinical hospital setting, maybe part of a public healthcare system. But you know, even when we were working out of the townhouse, we still charged $6,500 a person. We only took one person at a time, but in order to pay a nurse $1,000 to come, in order to work with our doctor, in order to feed a person, in order to, you know, we have at least 2 people on staff for the 10 days straight, you know, at only $15 an hour. You know, very quickly that adds up. So I think as this comes more into the light and where it's more easily accessible, then that's where it's going to happen. But we're trying not to raise our costs beyond what they're at right now. So I hope there's a way in the future that this is going to be made more widely available. Another thing that's happening is there are people working in Squamish, for example, that do more of the psychospiritual route, and they have been trained a bit more in the Bwiti way. You can bring in a group of people. There's a ceremony that happened a week ago or so ago with people from England that come.
No, with Ibogaine.
No, with Iboga, the root bark itself. Yeah, so by working with Iboga, the root bark itself, doing it in a group setting with people who are not quite as vulnerable as drug addicts, that's another answer.
The reality is, under the present social dispensation and medical ideology and limitations of awareness, it's impossible to bring this work in any kind of large way to the people that most need it. If, on the other hand, there was some, in other words, if the social understanding caught up with the reality, then we'd find that this is actually cost effective. Because if you looked at what it costs in terms of healthcare costs to look after people deeply addicted to HIV and everything else, if you looked at the legal costs, if you looked at the cost of the medications that they need, the methadone, everything else that they're taking and all that, we would actually be saving a lot of money. But as in so many ways, that would take some long-term vision and some openness that we're nowhere near having. And in that context, it's going to be what I said last night. The rich get richer and the poor get poorer. The ones that most need it will not have access to it, except maybe through acts of charity. For example, so if Trevor's Downtown Eastside initiative attracts funders and donors, but even that's going to affect a small number of people, I mean, at the very best. So really, the best outlook is if conferences like this and others, and an increasing consciousness of these possibilities and potentials is broadcast into the world and is taken to people in your lives, then perhaps eventually be able to make it happen on a social level. But short of that, it's going to be what it is, which is that the people with the bucks will get the treatment.
And that's another thing is, you know, an opiate addiction, a heroin addiction is very expensive.
Yeah.
So it's cost effective to spend $6,500 once and get that over with. Whereas Ibogane's been touted as something that's really good to help depression. I've experienced that as well. But depression's free, you know, it doesn't, in order to approach, you know, so it's cost effective for an opiate addict to come, or perhaps a different type of addict, but unfortunately it's not that cost effective for other ailments as of yet. People ask me, they'll phone and say, well, will this work for me? And I tell a story. We've had a 21-year-old man come in, still lived with his parents, hadn't been kicked out of the house yet, fairly new to using. It was still working for him. We treated him and he did eventually go back to using. Again, his life is much better now. And then we had a 39-year-old woman, been using for 20 years. By the time she came in to see us, she was injecting into her forehead, and that was the last spot. And she had fought for those 20 years to try and get off dope. She had tried everything to try and do that. And now she's here, star, and she's one of our employees. More than a year and a half clean, and she took what we gave her and almost 2 years, yeah. She took what we gave her and ran with it. She listened to our advice on, well, what are your empowering habits going to be? She put together a rule of 5 things she was going to do every day. So she just hit that point where she was ready to change. You know, you're sick and tired of being sick and tired. That's, I think, where you need to be. And we've seen, I mentioned emotional immaturity in that slide. The emotional immaturity is seen in acts like we treated a gentleman who came in. He had ordered LSD, he wasn't sure, off of the internet, had a horrible experience, 28 years old, had this horrible experience that stuck with him for days. So I don't know if it was LSD, but then he thought it would be a good deal to order some heroin off the internet in order to kill that pain. So he was here to us after about that, 8 months down that road, and he just it wasn't quite there yet. But again, I think he's doing much better.
You know, I understand your response. When Trevor said immature, I shook my head. Because what addict do I know that isn't immature by definition, you know? And immature not as a pejorative, but as somebody who didn't have the conditions where they could mature. You know, but then I thought about it as he was speaking, and it's my experience too. When you get very young people, they haven't suffered enough yet. Their suffering hasn't matured yet. They, like a young woman I can think about, did the Ibogaine. But you know, this is another one other than Cynthia, who I mentioned, but somebody who was still wanted to get validation through being sexually attractive to men. And that didn't change because she did the Ibogaine. So she got off her opiates, but she still kept creating a lifestyle for herself that incurred more and more suffering, and hence she goes back to her drug use. So maturation is kind of, arbitrary, render somebody mature. It's not a question of maturity so much, in my case, in my view, so much as, have I suffered enough yet that I get that this isn't working for me anymore? And some people are there, some people are not there.
So for one, Valium is not to be used in conjunction with opiates. So by the time we administer Valium, opiates are well out of their system. But we have tried everything. We've tried so many other things. Valium seems to be the most benign of what's available. I think you could go into more hardcore sleep things. Some people don't need it though, and some people have had issues with benzo addiction, and we don't administer it. So at around that 36-hour point, they're pretty close to falling asleep on their own. Well, I'll often say, don't take that Valium until you're almost there on your own. And that's just going to push you over the edge. But we use valerian root, we use melatonin, we use kind of copious amounts of valerian root even in the days leading up to the big dose. So we're totally open to other options. That's an incredible frustration for us. That's one of the worst aspects of this gig is if somebody just cannot fall asleep after. And we've seen that. We went through an experience recently with a gentleman where he was supposed to leave on Wednesday. We kept him till Saturday. That's the other thing, is it's not cookie cutter. You're done at 10 days, we'll push you out of here. If we see that somebody's not done, we'll keep them for additional length of time. But this guy did not sleep, until that very last day. And then he's, again, doing awesome. So we try and keep Liberty Root overall kind of as secular as possible. We want atheists to be able to come and do Iboga as well, although we had a lifelong atheist leave last week saying, I know there's a God now. So we try and, I'm a very spiritual guy, my business partner is spiritual, but we really try and keep it open to everybody. We do smudge, we do Native American smudging prior to any time administering the medicine. We often say that that's about as hippie as we get. But we play traditional Bwiti music as well, music that has grown out of Iboga. And but overall, the thing with Iboga is you mentioned kind of those resorts in Mexico. I say to people often, you're not coming here for a vacation. They'll say, well, what'll I do when I'm there? You'll be taking medicine every day when you're here, and it'll be between you and that root. So it's something there. We provide an incredibly safe setting. We check the set and prepare the set as much as possible in the client's psychology before we administer medicine. But then it's really between the medicine and that person. For us, of course, you saw the Bwiti. The Bwiti do a much different thing, and that's something I'm no expert on, but something I'd like to learn a lot more about eventually.